Next up is David Hood. David is not unfamiliar to St. Tammany Parish. He was the former Secretary of the Louisiana Department of Health and Hospitals, and before that, he was the, I guess the head of the Region 9, was it, David? Which was here in St. Tammany Parish. That's where I met you a number of years ago. David.
Thanks very much. I'm going to try to be quick, and I'm going to talk about something different from what everybody else has been talking about. And what I'd like to do is just step back, way back from small business and Louisiana for a few minutes and talk about how we got into this mess, or why health reform was needed or necessary at all. I know a lot of you may be thinking, why are they picking on us? You know, in small business, you know, now we've got a whole bunch of different rules to follow, etc. I think you know, if you look at it from the long view, it's going to be a good thing for small business. It's not going to be a bad thing. And here's some of the reasons for it. Now I can't quite read that, but the Affordable Care Act, you know, unfortunately is being at least partly ignored by Louisiana and many other states, and I know others have actually gone into that in some detail, and I won't go that far, but two that Steve mentioned, I think, or at least one, was the Medicaid expansion. Now, you would think that people would jump for that. It's a real bargain for all the states. Louisiana would probably benefit more than any other state. We could immediately, or within a couple of years, I think, make 400,000 people eligible under Medicaid that are not eligible now. Why are they not eligible? Because we've designed the program that way, unfortunately, and I'm embarrassed to say it. And the federal poverty level for an individual, let's use that example, just one person, and they would not be eligible at the moment. Why? Because their maximum income that they can earn over the course of a year is 11% of the federal poverty level. 11% of the federal poverty level is only about $1,250 or something like that over an entire year. I mean, that's nothing. And so we've said, no, you know, if something's wrong here, you've got to, the legislature did at least more than once. If you want to have health care coverage, you've got to go and get a job, get off your butt, and get out of here and go start working. You know, that's what we need, and pay taxes too. You know, that's really not the point. It doesn't work for a lot of people, and that's something that needs to be changed. Why do we need reform? Well, you know, from my viewpoint, coverage, cost, and quality as well. And that's generally the mantra from everybody that's ever looked at this thing. We need access to good health care for the entire population. We need an efficient system that controls costs, but the emphasis on controls costs. If Obamacare fails to control costs, then it will have been a substantial failure in that respect. This is very important, and I'll show you why in just a minute. And we need to always strive for quality. To me, it's all a matter of national security. I was in the Air Force, I was an officer for 6 years, and I believe in what everybody thinks is national security. You know, a well-armed country ready to respond to any eventuality, and I believe that too. But it goes deeper than that, and you know, if we have a substantial part of the population like we do right now that can't afford health insurance or is not eligible under any circumstance, and it is their pockets can't hold enough money to keep up with the annual increase in health insurance premiums. It's climbing much faster than employee than employee salaries are, and something like 5 times as fast. So I don't know how we're going to make it through that, and hopefully Obamacare will do it for us. What are the negatives that we see? Well, it's medical and administrative costs very high, 40 million uninsured, it lacks a cohesive system. What do I mean by that? Well, 1,300 private plans in this country, 50 jurisdictions, 50 states, 50 jurisdictions. We don't have anything that's uniform throughout this country. I think that's a big problem. Okay. On the left-hand side of this, you probably can't read much of it, but the steepest line, which is black, that's the United States. So the United States is climbing in terms of per capita spending on health care. And in fact, we've gone up much, much faster. If you look back at 1980 on the left side of that, it starts in 1980. And you notice that all these countries, see there's like 10 countries represented there, European countries and other industrialized, well-to-do countries like the United States or similar. But although we were there close to them in 1980, we said goodbye. We're going to go for high health care costs, and we succeeded. We're there. We're spending a lot of money on it, and yeah, we're number one. On the right is the percent of gross domestic product, and that's the entire economy. Economic activity in the United States is 20% or so, almost, is now devoted to health care. In 1980, it was less than 10% or so. It's been climbing rapidly, and it will continue to climb unless we control the cost of health care. And does that mean that health care is going to be worse than it was? Maybe we have to spend a lot of money to get a lot of quality. Well, no. Well, that's a slide of the uninsured. I think Steve knows that very well. And this, I really want you to pay attention here. I was talking about gross domestic product, and in 2008, the Congressional Budget Office did a projection of what it would be if we didn't get hold of our crazy spending on health care. And this was it. And if you notice, it's near 50% by 2008. I don't think I'll be around to see that, but 50% of the entire economy devoted to health care. I guess half of us would be sick, and the other half would be taking care of us, something like that, and there wouldn't be much else going on. So, and I don't doubt that this is sort of a fantasy, although that's what they did project. You take the numbers that we see up until that time, that's what happens. But we don't want to be there. So, and you notice that most of that is private sector. At the bottom is Medicaid and then Medicare. So hopefully we can get this monster under control. If not, I don't know exactly what we're going to do. And that is before and after reform. You notice $4.6 trillion would have been spent without Obamacare, and $4.3 billion they project. This projection says that would be the result, which is $0.3 trillion, $300 billion, $100 billion that we would save. Well, I would love to have saved $300 billion or even $300. But that doesn't seem like a lot of money. Now, over time, it gets better and better if we can just maintain what we hope we will do in containing costs. This particular chart, which you cannot see, compares our well-being or our health to 10 or 15 other countries. Again, the industrialized world, rich nations, so to speak. And what we find on this, because they only have two things. One is tobacco use, where we're doing well. We are doing well, and the other is obesity, where we're not doing well at all. But if you look overall at a lot of disease states and conditions and so on, what you find is the United States does not do any better, and in many cases does worse than all these other nations. And why is that? I mean, we're spending a lot more than they are. We're not doing any better, except maybe tobacco. So that's a real problem there. Let me point out the spending on basic medical and diagnostic services, and this was in 2006, per capita spending. The United States spent $1,495 per person for basic services in 2006. I believe it's gone up since then. The median amount for these countries that we're talking about, the industrialized world, was $337 per year per person. There's a big difference between those numbers. We're 400 and some odd percent higher than these other nations. Hospital dollars at discharge, the amount spent at discharge overall, $18,142 in the United States, and in these industrialized nations, it's about a third of that, $6,322. Physicians, the highest spike there, the highest bar is, of course, our physicians on each side. The left side of the graph is primary care physicians, and the right side is orthopedic physicians. They make a lot of money, and a lot more than any other doctors in these other countries as well. Prescribed drugs, of course, we're highest there. This one is the MRI scan and imaging fees. It's how much you pay to go get an MRI. And you notice the second from the left, that's the United States. And we spend, I think that says 1,200 or 1,500 is the maximum. The average is a little bit less, but what I want you to see is the one on the far left is Medicare, and they only charge $500 for an MRI compared to the private sector, which is much, much higher. What are we going to do about that? I mean, this is contributing in many ways to the problems that we have. And administrative costs are much higher. I had some experience with that. I mentioned community care, which was a state-operated managed care plan. We did that actually had been in effect for a number of years. We expanded it statewide in 2002 and 2003. Our administrative cost was about 3%. The administrative cost, when that was replaced by Bayou Health, which was private health plans, anything against private health plans, I'm in one, and they treat me just fine. But when you look at the cost, now we're going to have costs somewhere in the range of 14 to 15%. So our administrative costs and profits, including that, is almost maybe more than 5%. 5 times what we were spending on them. Medicare Advantage plans, I won't go into that. Some of you may actually be in a Medicaid Advantage plan. Let me fast forward to what Steve was talking about, and I think I didn't see his slide, but it's probably similar to this. The red amounts at the top are state match would be. That's how much we would spend in Louisiana dollars to cover 400,000 people or so. And the blue part is federal dollars. Normally, you know, our match rate is right now is about 35%. But in the Affordable Care Act of London here, there's no cost to the state for the first 3 years, and then it goes up gradually to a maximum of 10%. Now, why the governor and others don't want to do that, I cannot tell you. I can't fathom that myself. I think, you know, we ought to rush right into it before this margin disappears. But they don't want to do it. And then health exchanges, that will be the last thing here. Health exchanges are a great idea. Guess who came up with health exchanges? Well, it was the Heritage Foundation. Who are they? They're a right-wing conservative think tank. And they said, if you do this, then this is going to make competition better. It'll drive down costs. It'll make decision-making on the part of consumers much more easy, and so on and so on. And, you know, they were right. In fact, it's been tried. The first place was Massachusetts, and, you know, where they have what we call Romney Care. And so they did a plan like that, and it worked out very well. And that's how it got involved with the Affordable Care Act. That's why we don't want to do that either. I'm not clear about that at all. It would seem like a good thing. It would bring the marketplace back into healthcare. Healthcare is not much of a competitive marketplace. I mean, yes, I know plans and hospitals and so on compete against each other. But when it comes to the consumer, it's not working for the consumer. It's working for everybody else. It's not working for people who need health care. So hopefully we'll find solutions to all this. I hope that guy that he's got the same name as the guy I work for, Dr. Kendall, hopefully he'll come to his senses and let's get this done. It's high time to do it, and we don't need to be the most expensive in the world and not get any better quality health care. Thank you very much.
Thank you, Dave.